Ghana may be only a few thousand miles from the UK, but medically, it's a million miles away. But thanks to a dedicated team of British doctors and nurses, all volunteers, some hope for the people of Ghana exists. By treating one of the most common medical conditions in Ghana, a simple hernia, these surgeons are making a huge difference to people's very existence. A team of 12 doctors and nurses flew to Accra and then travelled 10 hours by bus to the north of the country. Here, in a small rural village, a basic hospital had been built with 2 operating theatres.
Dr. Andrew Kingsnorth heard about our work and came here and checked at the place so that operations could actually take place in this rural setting. And because we really liked the program and we were desperately needing such help, we put a modest place together.
For the past 4 years, this vibrant yet poverty-stricken country has been a destination for a team of surgeons from Devon.
This is a very rural, isolated area with a high level of poverty, no health care, and hernia is completely neglected. So the numbers of hernias have accumulated over years, and we've detected a population of only about 50,000, probably 1,000 hernias. So there's a big, if you like, public health issue here about managing these patients who have no surgeons to treat them. So we think Operation Hernia could serve a very useful purpose here. And although this year we're only going to treat about 70 or 80 patients, there's plenty of work for us to do in the years to come. Operation Hernia runs about 10 missions a year now, and we begin planning each mission about 9 months ahead of time. First of all, we have to get the commitments of the teams themselves, that's the individuals, the surgeons and the nurses, and then we have to begin to get the equipment, which all is donated. And that means a lot of equipment has to come out here in advance. We usually send it out by container. Many people are involved, and it's quite a lot of hard work.
With the medical equipment having arrived safely, a small army of local helpers, community nurses and healthcare workers all lent a hand to ensure everything was ready for the operations to begin. In the Western world, we have little comprehension of the effects a hernia could have on our daily lives. But in Ghana, where access to treatment is scarce, it's a massive public health issue. And a simple operation is all it takes to transform the lives of people, such as Peter.
He says
his name is Kwabena Peter. He has had this hernia for years, and I've really struggled with it. Many times he has tried to farm to feed his family, like other men are doing, but this hernia has just really set him back. He feels quite discouraged sometimes because what he would have wished to do, he's not able to do it. To have the British team here bringing medicine to his door, to get this help from this team, it will be just tremendous for him, because he will then be able to care for his wife and children well, be able to help them to go to school, and he will be able to be effective as a man at home with the family like other men who are actively working. And he knows that this is going to make a whole difference in his life.
One of Operation Hernia's founders is Devon-based Ghanaian Mr. Chris Apong.
I've opened the sack. Just before we started, I asked him why he hasn't sought medical attention up till now, and he said he couldn't afford the costs of hospital treatment. Obviously, we've come and are offering our services free. So it's an opportunity for him to have this debilitating condition sorted out at no cost to him. The operation is being done under local anesthetic. That's why he's awake. I've injected enough local anesthetic to make the area very numb, so he shouldn't really feel much pain.
I'm operating on a patient of about 56 years. We're not too sure of the ages of many of these patients because they don't know their age, and he's got a hernia of about 15 years standing. Because it's been there so long, it's very large. We would rarely see a hernia this size back in Britain.
A hernia, if not repaired, can obviously become strangulated, and strangulation could be fatal. So, yes, hernias, if left for a long period without treatment, can become strangulated.
I can feel inside this hernia is probably about 2 or 3 feet of intestine. And when he stands up and strains and does some work, another few feet of intestine will drop into the hernia. So you can imagine how painful that would be. But these patients have put up with things like that for years, and so they've put up with the pain and pass it off as a fact of daily living for them.
The lives of these guys will be transformed because a hernia is a very uncomfortable condition, and it makes it difficult for them to do their work.
I'm going to remove the hernia, and we're going to repair that with mesh.
So you can see how repairing their hernias does not only improve the economic status of the individual patient, but it actually eventually does improve the economy of the local community. Yeah, I like the cock crow in the background.
I think what Operation Hernia has done on this occasion in coming to northern Ghana is raise people's expectations and raise people's awareness of Operation Hernia, and also given them hope that there may be a team of surgeons who can come out here and help solve the problem of hernia. In addition, we've made contacts with the local hospitals, and we hope to have some input into training their surgeons and also making them aware of the very major problem that they need to address by building more hospitals and training more surgeons.
Help me decide.
The important thing is that the lives of these guys have been changed completely, and at the same time improve and enhance their ability to earn. And that will go a long way to improve not only domestic economics, but also the economics of the local community.
I long to answer the call of the wild. Sometimes I feel like a feline adrift on the ocean. There's beauty and wisdom the Grandmaster tells. Assassins in hiding, colliding like shells in the sea.
If you're watching this program, you would wish to help with this project. I'd just like to encourage that any help is very welcome, and you can contact Operation Hernia through Professor Andrew Kinsnorth at Derriford Hospital, or myself, Chris Opong, at Derriford Hospital, and we'll be happy to receive any help and support that you would like to give us. We can assure you that everything you donate is going to be put into providing quality service to patients who are at a disadvantage here in this country.
Tell me, is there for the